Welcome to another edition of Cults and the Culting of America podcast. My name is Scot Loyd, along with knitting cult lady Daniella Mestyanek. Young Daniella, it is Rapture Day, and we're still here.
Rapture Day. I didn't get raptured. I'm ready. I'm in my finest whites. I've got Saturnita, my little planet here. It's very disappointing.
Not yet, anyway. I suppose there are a few hours left.
Reports from Australia have come in.
We are grateful tonight to have Joe joining us. Joe, it is an honor to have you on the podcast. Why don't you take a moment and introduce yourself to our audience?
So great to be here with you tonight. So I am a veterinarian in New Orleans, Louisiana. I grew up in Montana and came down to New Orleans to attend Tulane University in 2001. Graduated right before Hurricane Katrina. And thankfully I was not still in college at that point, but we did live here still. So spent a little time back in Montana after Katrina and came back late in the year after the city was reopened, and basically started working for a veterinary clinic as an assistant after graduating from Tulane. I had really, in my mind wanted to attend vet school or med school, but I wanted to sort of try it on, see if it fit well, see if I could, handle the emotional aspects of vet med. And I really loved it. I mean, obviously we're here tonight to talk about some of the, I guess, good and bad points of veterinary medicine, but ultimately went to vet school back in Colorado, in Fort Collins, and moved right back to New Orleans after I graduated. So I've been a vet here since 2011.
And so, of course, there's great things about veterinary medicine, just like there's great things about regular medicine. But one of the things that we tend to find in the study of cults, so two interesting things. Cults hate medicine, and also that when I talk about cult stuff and I break down like the tactics, the techniques, the procedures of cults, the individual things cults do, people from the medical personnel will often compare themselves to that. And I'm just fascinated to know what you think about any of that.
So I have to be honest, I had never really thought about like cults with respect to medicine, or particularly veterinary medicine, until we sort of started talking about doing this podcast. And it is really interesting, some of the parallels that come up, especially with what we call like the helping professions, right? Like doctors, pediatricians, therapists, occupational therapists, veterinarians. And I do think there are a lot of interesting parallels and sort of culty qualities of veterinary medicine. A lot of the sort of like overwork as a virtue, and sort of moral injury and guilt as like a method of control, if you will, I think are huge in veterinary medicine, particularly because we are, we're dealing with animals, which is just an emotional thing in and of itself. But I think as vets, we care tremendously about our patients and our clients as well, for the most part. And it's really hard sometimes to turn off that compassion that we have and that, desire to help when it comes to, either failing and losing a patient, or not being able to work to make it happen financially in some cases. So that's a huge thing, I think, with a lot of vets.
Joe, initially, what attracted you to veterinarian medicine? Did you have a love for animals growing up? Was that part of it? And my follow-up question will be, what did you expect that it would be going to veterinarian school and then getting into the profession? And then what was it in actuality that sort of maybe showed you the real side of veterinarian medicine, as opposed to what you thought it would be?
Yes. So those are great questions. So I think for me, yes, of course, I think anyone who goes into veterinary medicine has a love of animals and living things. And I think that's, whether you grew up in a city and had a pet cat or grew up on a farm and were used to, more of the large animal focus. I think that all of us get into veterinary medicine to care for animals and be able to make their lives better and our clients lives better. I also really, as I went through my education, I was really into the challenge that veterinary medicine presented. I do think that we in veterinary medicine have this amazing opportunity to challenge ourselves every day. We see so many different species, even if you're just a small animal veterinarian that sees dogs and cats. And a lot of times we'll see wildlife that comes in. We might see like guinea pigs and rabbits, and if you're a mixed animal practitioner in a rural setting, you're going to see everything from large animals to reptiles and exotics and dogs and cats. And basically, as a general practitioner, we're doing like everything from pediatric care to surgeries to internal medicine, where they're eye doctors, where they're dermatologists, where they're heart doctors. We're basically everything. Obviously there are specialists available for a lot of those sort of niche, more specialty treatments that they would need. But yeah, it's a challenge. Every day I see new things, and I get to, I got to take care of an injured crow the other day, and I occasionally see other wildlife. And, I have a tiny little baby kitten foster right now that I'm sort of trying to keep alive here. But it's a challenge. Every day is a challenge. I do think that, hearing a client say like, oh, you have such a great job, you just play with puppies and kittens all day. And that is, I think that for the little kids that want to be a veterinarian, that's the dream, right? To get to just play with puppies and kittens all day. And it's a lot more complicated than that. I think that as veterinarians, we see people through the entire sort of spectrum of the human animal experience, from the joy of getting or adopting a new pet to, going through the emotional roller coasters if they get sick, to, either losing them at the end of their lives or through some, tragic illness or through humane euthanasia. But we go through all of these things with our clients. And it's an emotional roller coaster of a job, and so that is one of the things I was sort of prepared for, but maybe not to the level at which we experience those highs and lows.
Yeah. So one of the interesting things to me on our fact sheet for talking to you for tonight was that veterinarians have a high rate, which is something that makes my cult spidey sense go up. First of all, I wondered if they mixed up vet and vet, veteran,
No.
veterinarian.
Not.
But we see this a lot in cults. And I think there's an interesting thing in the helping professions, in the passion jobs, in almost any job that people got into because they have a passion for it. It's easy for that passion to kind of get exploited. And I would especially think, as a veterinarian, there's a lot of attitude control in your job of just bedside manner. You're seeing people, like you said, on their best days, which I assume is easier, but also on their worst days, which can be really hard. And having to maintain that very kind of stoic, masking, if you will, appearance. This is one of the things that I think ties to in cults, and I wonder your thoughts on that.
No, I think that's a really good observation, because in, any given day as a veterinarian, and I think that honestly, ER veterinarians probably get the worst of all of this, because, they're seeing clients who they often don't already have a pre-existing relationship with, in a very high intensity, high, emotion situation when their pet could have been just hit by a car or, is dying of congestive heart failure. And they're having to go from appointment to appointment, going through all of these emotional, situations with the owners. But yeah, even as a general practitioner, I might have to go from putting to sleep a patient that I've been seeing for the last 12 years for its entire life with clients who I love and adore to like a new puppy visit or like a wellness visit where I have to go from, crying with my clients who have just lost their beloved pet to, just kind of turning around and being kind of my normal, bubbly self and trying to move on to the next visit, and kind of trying to let that last visit go, which is really hard to do emotionally.
I was wondering, Joe, about dealing with people. I know in the medical profession, I imagine that there are a lot of doctors, even in veterinarian medicine, where the patient comes in and the owners of the patient may tell you that this is the problem, but you have to correct them with information. And I think even in the larger conversation that we're having in our country right now, just yesterday, as we tape this, the Health and Human Services Secretary came out with some information, and there's a lot of controversy swirling around who has correct information, who doesn't. How do you handle situations like that where a patient, or in your case, the owner of a patient, is telling you, well, this is the problem, but you have access to more information, more training, more scientific discovery than they do? How do you handle those particular situations? And does it come up often? And then also, I would think if people are correcting you that don't have half of the training that you do, that could also contribute to low morale and difficulty mental situations for veterinarians.
Absolutely. I mean, those are always hard cases because I think, I like to always think that everyone has the best interest of the pet in mind. And so I think a lot of times when people come in with that viewpoint, they've, in a lot of situations, they've been Googling something and they've been trying their best to understand what's going on with their pet because they're worried about them. And I mean, I think it does, it runs the gamut from clients who are, I think with the appropriate communication style. I mean, I think if you come at them and say like, no, you're wrong, this is stupid, this is the right answer, that not many people are going to respond well to that. But I think just approaching from a place of understanding and saying, look, I understand that you're worried, you're concerned, like here are some thoughts that I have based in science, based on your pet's physical exam, based on the diagnostics that we can do. And, my goal is to always work towards the best outcome for the pet. Like if we need to come to some sort of middle ground where maybe I'm not necessarily going to be coming out, with them agreeing with me, but we can find some middle ground to take care of this animal. I think that, those situations are, but they're always tough because, sometimes you just can't change people's minds and we know that. And whatever I can do as the veterinarian in that situation to help the animal is what I'm going to do my best to achieve. There are cases where, people will take their animal home against medical advice. And that happens in veterinary medicine not infrequently. And I think a lot of times as veterinarians, we internalize that as, our failure to be able to show the client, that what truly is going on with the animal, or a failure to be able to, save that patient or make that patient better before they leave. Those are really tough because, I think many veterinarians are, we're perfectionists. We are, high drive people. We're very compassionate people. And I think a lot of us are sensitive introverts, and that kind of is a recipe for disaster when you feel like you're failing your patients, you know.
Daniella, earlier you raised an interesting question that I wanted to follow up with you about, and that's the idea that we know in cults and a lot of these high control groups, they have a disposition where they are often adverse to any medical treatment. But what did that look like for pets? And in the children of God specifically, your circumstance, were families in the cult allowed to have pets? What did that look like? And also, if the pet became sick, was there any protocols in place? What did that look like as far as interacting with veterinarians or medicine in general?
Yeah, it's interesting. I've been thinking about this over the last few days, talking about lack of empathy, you know. So first I would say, like, in the cult that I grew up in, we just didn't really have possessions. You know, there's a part in Uncultured where I get a Bible as a birthday gift, and I'm like, yes, I won't have to share this, and nobody can tell me I'm being too selfish with it, and nobody can tell me I'm too obsessed with it and take it away. And I was like, a little autistic girl, this really sucked because you couldn't have anything. So, but then I would say, like, in cults, you have this tremendous lack of empathy because everything is hierarchical and everything is about labor and everything is about profit. And like that gets passed down to the children. And, you know, experts like Daniella have said that in almost every cult you see, like children are extremely controlled and abused in a harsh way. And I feel like if that's how they treat the children, even more so for the animals. So like, I mean, for sure, I was in a different cultures too, so it's hard to say because like the animals didn't live inside, but it was much more a la the farmhouse life, right? Like the kids work outside all day, the animals are out there, like the kids are cleaning up after the animals, and it was much more about utility. Like we had dogs as guard dogs, and we had cats for catching mice, and I did get the experience of getting to have like a turtle for a few years when I was between 10 and 12. And it was because my grandfather, who was a big, famous, fancy leader, bought it for me for my birthday. And so nobody could take it away or say it had to be the whole group thing. But, I will say it's common, it specifically with like the Amish, for example, that it's like it's known that they're just very, very terrible to their animals. And it is this, in my opinion, this sort of lack of empathy and deadening of even just the concept that you're an individual and like you exist to like be and not just serve, if that makes sense.
Yeah, and Joe, just to kind of follow up on that, in your experience, I imagine that you come across pet owners who maybe the perception is there's not a whole lot of empathy here. But my instinct would tell me if you have a pet, right, if you have to care for an animal, that should develop empathy within you. But I'm assuming that isn't always the case.
In terms of clients, of course, you know, like Daniella said, people have animals for all different reasons. You know, people have dogs that they use for breeding, and that's it. You know, now are there people who breed their animals that care about them? Of course. Are there people that, you know, have dogs that they breed until they are not producing litters of puppies and then dump them off at the shelter or on the side of the highway? Yes, there are those people as well. You know, my two cats, I adopted a couple of years ago. They were dropped off at a veterinary hospital as a convenience euthanasia because of change of lifestyle. And, you know, they were seniors, so they were about 12 years old, but they were otherwise healthy cats. The veterinary hospital did not euthanize the cats and ended up, you know, basically putting them up for adoption. But we're faced with those types of things as well with clients who, you know, they bought a puppy and it never took it to the vet and it didn't get any vaccines and it gets parvovirus. they bring it to the clinic, and parvovirus is a devastating disease. It kills puppies if they haven't been vaccinated before they are exposed. And, I've had clients who say, just euthanize it. I'll just go get another puppy. It's cheaper. And then, we're left as a veterinarian with a puppy that we're either having to euthanize or, if we can save it, do we spend our own money on that puppy? Do we spend the clinic's money, a clinic that has to, continue to pay its staff and stay open? And so that's a huge ethical, issue, I think, for vets, is, how do we cope with having to lose patients whose owners can't afford care or don't want to pay for care, when we're the ones that are essentially going to be ending that animal's life? That can take a huge toll.
So how do you cope with it? Like, how do you cope with the job? What do you have rituals of any sort?
So I think that resiliency and self-care is a work in progress for me. I've been out of a while. I mean, I've been out almost 15 years from vet school. I have yet to master the art of work-life balance, and I'm pretty far away from it, I think. But I think people cope in different ways, but I think that is one of the issues with the rate in veterinary medicine, or the burnout rate or compassion fatigue rate, is, what really honestly keeps me going is the relationships that I have with my clients. Like, I could never practice ER medicine because I don't think that I could emotionally cope with just seeing clients like all night long on my shift that are either yelling at me or sobbing or going through all of these emotions and have like no relationship to kind of feedback from. Whereas, a lot of my clients, since I have an established practice, I am seeing a lot of clients who I've known for a long time. I'm seeing a lot of new clients that have been referred to me. So that really, for me, is where I kind of draw my strength, knowing that that I have these relationships and these, I guess, these people who depend on me, but also support me as well. I've become friends with a lot of my clients who I've seen for a long time, and I think many of them are amazing and wonderful people, and that for me is where I draw most of my strength from, I guess, as a practitioner. But I do work insanely long hours. I generally don't have time to go to the bathroom or drink water during the day. Like, it's, self-care is not really an easy thing, because if I take 10 minutes to drink water and go to the bathroom, my client is waiting 10 minutes, in back-to-back appointments. And I think that's something that a lot of veterinarians, and vet techs end up, suffering from, is just lack of self-care. But a lot of times it's kind of a more global issue in veterinary medicine. It's not necessarily that we're not wanting to take care of ourselves. It's that, we feel guilty if we can't fit that patient in that wants to be seen, during our lunch, what would be our lunchtime, or, this cat that we saw a couple of days ago is not doing well and we have to squeeze them in at the end of the day, or we feel like we need to do that. And so I think there is a balance, and I think some people are better at setting boundaries than others. I don't know if, for me, if that's, I think for me, honestly, at this point in my career, it would be a little bit harder for me emotionally to refuse to see some of those cases versus feel like I'm, taking the lunch that I needed for self-care. Like, I think I would be sitting there thinking about that dog or that cat for my whole lunch, and I wouldn't enjoy it. And then I would just squeeze them in at the end of the day. But it depends on, the vet and the hospital. And I mean, I think there's a lot more awareness now of sort of mental health in veterinary medicine. So, there's a Facebook group that I think a lot of veterinarians are a part of that's called Not One More Vet. And it's kind of a sort of support network for veterinarians who are, going through mental health issues or having a terrible day or need to vent about something with other veterinarians who understand. I think resources are much more readily available than they used to be for veterinarians, but yeah, self-care is a hard thing, I think, in a lot of professions.
Well, and it strikes me, and Scott might actually, or Scott, I know will have some insight into this as a former pastor. When you said like you're involved in such emotions with your community and you get some support from them, but it's not really like an equal thing. And so there must be, Scott, I don't know if you can speak to this, like a level of it that does you good because you really are engaged in true community and true connection. But at the same time, if you can't turn off.
Yeah, and I think what Joe described is speaking beautifully to what you touched on earlier, and that's this commitment that those of us who sign up for these service-oriented positions where you're serving a community, this larger mission, right? And we talk a lot about this commitment to the mission that we are is sort of ingrained into our psyche as someone who wants to serve, someone wants to help. But an analogy that I often use was the fable of the goose that laid the golden egg, right? At some point, there is a lack of return on investment, and if you continue giving and giving and giving, and nobody is putting back into you, then you're setting yourself up for problems. And I think a larger conversation that we could also address here is that those of us who have been born and raised in the United States or are laboring under what capitalism looks like now in our nation and around the world, there is this unspoken idea that working yourself to death is a noble thing to do, that pursuing more money, that giving of yourself in more hours, more time, more investment, those of us in the United States chasing the unachievable American dream, that is baked into our identity. And if we aren't doing that, or if we take a day off, or if we self-care or take a moment for ourselves, we feel guilty because not only are we going against our passion or what we might define as our calling, but there's the larger expectation of capitalism that says, no, you were born to consume and to produce. And in order to continue consuming, then you've got to produce something, or you've got to make money. You've got to achieve this unachievable dream. And it's just it's a hamster wheel that we're all caught in this loop. And I certainly agree with you, Joe. As a pastor, I felt the same way, right? I wanted to work harder. I wanted to achieve more. I wanted to do more for the folks that I was serving. But in the end, right, I just ended up burning myself out. And I'm sure that's what a lot of people in veterinarian medicine or other professions feel.
Yeah, absolutely. I mean, I think there are a lot. I mean, that is one of the reasons why we do have essentially a shortage of veterinarians, in this country compared to the animal population. COVID particularly, as I think many people know, a lot of people adopted or got animals during COVID. They were sort of stuck at home and felt like, oh, this would be a great time to adopt a puppy or to get a new dog. And at the same time, we still had the same numbers of veterinarians, also working in clinics where we were, along with other healthcare professionals, were some of the only people really out at our jobs full time, seeing curbside appointments. We were stuck in one exam room with our tech for the entire day, basically shuttling animals back and forth to their cars. And that was a really harrowing experience for a lot of veterinarians. I think it was extremely stressful. You were communicating with clients basically on their phones from the parking lot. And a lot of people burned out during that period of time. People were having to wait long times for appointments because there was a shortage and we were doing the best we could. Yeah, there are a lot of people that just said, like, I can't do this anymore, or I'm going to, work from home or go into industry or just stop practicing during that time, just because that was a hugely difficult experience, I think.
Joe, can you talk a little bit about the cost that's involved in veterinarian medicine? I'm just thinking about what happens in human medicine with everything that's around insurance companies, things of that nature. What drives cost in veterinarian medicine? Does it parallel what we see in the human medical profession, or are there different factors at play? Speaking of American capitalism, right?
Yeah, kind of depend on the market that you're in, like in terms of the cost of operating a hospital, for example. So, there are different forms of veterinary clinics. There are mobile clinics. There are brick and mortar hospitals. I do think that, property ownership and the cost of, just maintaining electricity and maintaining a building and a hospital, along with equipment, certainly drive costs. We're usually using, in addition to being able to run in-house labs, we're using outside laboratories, and those costs of outside testing are kind of constantly changing. Surgery costs, you're looking at suture, you're looking at surgery packs, autoclaving and sterilizing all of your surgical gowns and your surgical equipment, which takes tech time. And I think payroll is, like in many professions, one of the biggest factors. But at the same time, veterinary professionals, including our, amazing assistants who work their butts off just like we do, our technicians, do not get paid well across the board, compared to like a human nurse or a human doctor. We're making significantly less, where, even here in New Orleans, some of the starting assistant jobs are making less than if you started, as a waiter in a restaurant, in the service industry. And yet you're a skilled professional that's going to be caring for people's animals. And I think it depends on if you're in a privately owned, like, small practice versus a corporate practice. How much control you have as like a veterinarian owner versus like just an associate veterinarian on the pay that the staff, receives. But when I hear, someone say like, oh, well, I know by, taking my dog here, I've paid, to put all of your kids through college. I'm like, well, no, actually, we still can't pay off our student loans because we're in so much debt. But it really is one of those things where I think when people truly see what the cost is, if I have to do a major surgery on a dog, say I have to do an emergency splenectomy, you're probably looking at about $3,000 at the practice that I'm in for, emergency treatment, open abdominal surgery, where we have, multiple technicians working on the animal. I'm scrubbed in with another assistant. The animal's getting pain management, IV fluids, continuous blood pressure and ECG monitoring, and, multiple days in the hospital, maybe a blood transfusion. Compare that to, I had a very minor procedure that took about 5 minutes at our local hospital that was very quick in and out anesthesia last year. And the amount billed to my insurance was $33,000 that was an open abdominal surgery. I certainly was not in the hospital, for more than like half a day from going to the hospital to leaving. And I think because of, and I'm not an expert on the cost in human medicine, but I think that people have sort of a very skewed view of what things actually cost, what it costs to pay for the hospital, what it costs to pay for, staffing and sort of the actual items that you're using for a procedure. And so when they hear $3,000, that sounds like a lot. But in pretty much every venue that I know of in veterinary medicine, everyone is trying to keep costs down as much as we possibly can because we want to treat our patients. And when you look at the cost of that emergency surgery, that's a life-saving surgery that we can do for $3,000 compared to $33,000 for like a very quick 5-minute procedure. In human medicine, it's really amazing to me sometimes that we get so much shock and awe at the at the cost of some of the procedures that we do.
Yeah, and a lot of that is tied to factors beyond your control, right? It goes to the larger conversation that we're having in this nation about cost and capitalism and people at the bottom often bearing the brunt of the benefits of those at the top. Sort of related to what you just had to say, just something I'm curious about. Obviously, pets have shorter lifespans than us humans, but we can get very attached to our pets. And I imagine that sometimes you have to have, as a vet, those quality of life conversations with the pet owner, because it seems like increasingly, because of the quality and the advances in veterinarian science, I imagine that there are a lot of times where the pet owner wants to keep the animal alive, but the animal doesn't really have a quality of life. What does that look like for you in your profession?
So that is something that we have to do day in and day out, is have quality of life discussions with our clients. And I do think that one of the things that is very different in veterinary medicine than in other healthcare professions is, I think, have kind of a shifting view of euthanasia and therefore of death as we move through our practice. And I think that we come to recognize euthanasia as a way to prevent or relieve suffering in our patients. And that can be, contrary to people's religious views. It can be contrary to what they, think in their minds that they want for their pets. And so, quality of life, I think, for any treatments that we offer in veterinary medicine is paramount. So whether we're offering chemotherapy to treat cancer or, for something, that's ailing a pet, the ultimate goal is to maintain 100% quality of life. And when you get to the point where you can't do that anymore, I think it's very difficult as a veterinarian to talk about hospice, right? Like we sort of envision with humans. If you don't have, the ability to obviously elect euthanasia, which most of us don't, because I think we can see that in animals, a natural death is scary. It's confusing. It can be uncomfortable, and it can be very hard as veterinarians to care for a pet who's going through the process of dying. And it can be very difficult to cope with sort of the emotions that we feel not being able to relieve a patient of their suffering if a client is not inclined to pursue euthanasia. So I think that can be one of the really challenging things in our profession is we might see a patient suffering and feel, potentially the opposite of our pet owners. And I think all of us do try to support our pet owners as best we can. But I do think in many cases, if we're talking about euthanasia, that there's something that we're seeing that makes us want to move at least to discussing it.
And kind of, I guess it's like the flip side question of when there's nothing wrong with an animal, but people want you to euthanize it. Do you have to do that? Is it like owner's choice? Are you able as the vet to say you don't want to be part of that? Like, what is that process like?
So that's incredibly challenging. And I think, thankfully, I have not encountered that many times in my career. I do think that sometimes people when requesting euthanasia feel like there's no other way, or, they feel like they can't take care of their pet, but they don't want it to end up in a sheltering situation. And I will say that most veterinarians, do everything we possibly can to avoid euthanizing an otherwise healthy animal. We do have to perform behavioral euthanasias. And that is something that I think is also emotionally challenging. But at the same time, one of our duties as veterinarians is to, protect the public and to protect public health. And if we have patients that are, biting, scary, non-handleable by their owners, that we've tried, a lot of things to help, there are situations where behavioral euthanasias are unfortunately appropriate. And, I think especially this day and age when we have so many animals being euthanized in animal shelters. I mean, I think the most recent statistics were almost 1 million animals in the US being euthanized in shelters every year. And many of those are highly adoptable animals. There just isn't enough space. There's not enough, there's not enough rescues or enough fosters. And so, it's horrible for the individual animal, but in that situation, can you, ask a rescue to take on a patient or a pet who is an aggressive animal, and try to rehab them? I think for veterinarians, we have to make that call sometimes to say, like, I don't think there's anyone else that can take on this pet. The other flip side to that is, you have a client come in with a dog who has epilepsy, for example. I encountered this when I was in vet school at a hospital where I worked. A client brought in an extremely giant breed dog that was having seizures and was biting when he was post-ictal. They did not have the money to be able to treat his epilepsy, and they came in requesting euthanasia, which the vet did not feel comfortable with. The client then proceeded to say that they would take the dog into the parking lot and shoot it in the head if she didn't euthanize the dog. And so she euthanized the dog because it was a kinder death than, the owner shooting it in the parking lot. And I don't know if that would have actually happened, but those are the things that we're faced with, on an unfortunately frequent basis. Is it kinder for us to offer this euthanasia if we can't find any other options? Because I think the alternative, if that's what the owner wants, is the dog getting thrown out of a car on the highway or let go in the middle of the bayou, or, whatever. Well, we find animals in garbage bags on the side of the road sometimes. So it is, it is a difficult thing, but I think sometimes we will perform those euthanasias because we don't have any viable alternatives.
I think what your experiences have taught us, along with what we talk about frequently on this program, is that all of us, regardless of our profession, we can be susceptible to these cultic tendencies. And so I'm wondering if you had the opportunity to speak to your younger self or to speak to an aspiring veterinarian, what kinds of things would you tell them as far as self-care, things of that nature? What kind of advice would you give them if they're going into your profession to sort of avoid becoming a cult member, right, in veterinarian or whatever profession they might choose?
Hard, because I do feel like it's so ingrained in veterinary medicine, and I will say, I think that some of the younger veterinarians coming up are, they're getting more access to sort of prep work in vet school on, like, how do you take care of yourself? How do you avoid burnout? What are some, sort of boundaries that you need to set before you even sign a contract with a veterinary hospital as a new vet? And I think that a lot of those, younger veterinarians are better advocating for themselves when it comes to workload, when it comes to work hours and the expectations going into it. Now, I don't know if that translates necessarily into a better work environment, because again, I think that the people who want to become veterinarians and who get into vet school and become veterinarians, I think we all have a fairly similar sort of profile. You know, we are perfectionists. We do have some of these sort of characteristics that I think make us more likely to fall into that trap.
Well, and it's also something we just see very often in the United States with many people that we talk to, where it's like you're still just counseling the individual to do their best to try to protect themselves against the institutional culture. And there's no ever any addressing of the institutional culture being problematic.
Yeah. No, you're right. And I mean, I think as much as we might try, you know, we are in a helping profession. And I think, you know, that in and of itself makes it challenging to turn off. Like you said, when you're, you know, a pastor, it's really hard to say no. It's very hard to say no. But I do think that, you know, for people who are thinking about going to vet school, I do think it's a good idea to work in a veterinary clinic before you commit. You know, make sure that you understand, you know, at least the basic mechanics of working in a veterinary hospital. In vet school, take advantage of the resources and the courses that, or even little extra things that you can do to try to train yourself to be resilient and have that self-care. And, you know, we can't fix everything. I think as veterinarians, we want to fix everything. And we want to fix our clients. We want to fix our patients. We don't ever want to feel like we failed. And ultimately we can't be the you know, everything to everyone. And that's challenging to accept, I think, sometimes.
Well, I mean, this is also a common trend that we have in a lot of places. And, you know, I remember something that was really helpful to me that a boss told me once was like, you, First Lieutenant Mestyanek, are not going to solve all the world's problems, you know, and this kind of like idea that it's actually kind of ego to think like you're going to fix all the stuff. And even when you're in these helping professions where you do like see the help that you're doing every day for people, but I think a little bit of reminding yourself. And this is one of the things we see with cults, right? Like every cult tells you you're special, you're saving the world, you're changing everything. And when you're in these jobs where you are one piece of a system, I think it is really important for our mental health to remind ourselves sometimes, like the world is not going to collapse if Joe doesn't squeeze that patient in, you know, like there's a whole system involved here and you're just a piece of it.
I think that's really important to remember. I have a dear friend who's a veterinarian whose dad just passed away, sadly. And, you know, she is really struggling with not going back to work yet. And I said, you need to take care of yourself. They will figure things out. You know, they will figure things out. But I will say, you know, as a pet owner, I think how we behave as clients in a veterinary practice really does make a huge difference. From the receptionists, our client service staff, just being kind to people. You know, we all love our animals and we're all worried about them. And, you know, we're worried about your animals too. So, you know, I think just being kind and understanding if we, you know, just had a hit by car come in and you're here for a puppy visit and end up having to wait 15 minutes, you know, being understanding in that situation. It is a very difficult profession, and I can't even express how much of a difference it makes when people are just kind and understanding. So,
and I think this conversation is illustrative of the larger issues that we're feeling, that all of us are feeling right now. It just seems to me, and perhaps this is nostalgia talking, but it seems to me that in past decades, a profession like veterinarianism, being a pastor even, some of those professions were protected from the institutional cultural influences. But now it feels like the world is shrinking and there's a lot more pressure, right? Whereas in the past, perhaps your job was an escape from the world. You were serving people, you were helping people. But now, the larger the meta cults or the institutional influences that Daniella is speaking of, all of that is being brought to bear so that you're feeling it in a profession like veterinarian medicine, which really, if you think about it, right, you're serving people, you're serving people's pets. You should be immune from those larger stress and anxiety things that are happening in the world. But unfortunately, it seems that's the world that we're living in right now.
And this to me was also just a good reminder of how much I think even like professions, a uniform, titles are all things which are like dehumanizing, right? They're part of a system. And like now you're the veterinarian, you're not Joe. It feels very different me talking to you, sitting here, Joe, you're in my friend's house. I saw you playing with her dog right before we got on, right? Like very human compared to the sterile office, and this to me has just been interesting, and it made me like stop and be like, how often do I think of veterinarians as humans, which is like literally almost never. I don't have a close friend that's a veterinarian, and that's a transactional thing. And I kind of love this right now, as Scott was saying, that like everything in our world feels like it's blowing up and moving at a faster pace. And just a reminder that like everyone's a human. That person you saw might have just euthanized a dog that they've been caring for 12 years. And like, you don't know.
To think about, yes, when you go see your veterinarian. So tell them you love them if you don't mind.
Well, Joe, that's been what you've had to say has been very helpful to all of us. And we appreciate you sharing your experiences with us. And I think that's a timely reminder, right? That all of us are living in the same difficult world, and we all would do well to be kinder to one another. So thank you.
Agreed. Thank you guys so much for having me.
Thanks, Joe. Thanks, Joe. This has been such a wonderful conversation. I would love to remind everybody that Scot Loyd has a new book out, and I believe that the audiobook is out, which you want to hear with his rumbling, deep radio voice. So check out The God I Was Given, sorry, Scott, what's the subtitle?
Looking for Faith After Losing My Religion. But thank you for the endorsement. I appreciate that. Thank you so much. And, it's very timely because I talk about in the book, being scared as a little kid of the rapture. And we talk about the origins of the rapture, where those ideas come from, and the implications. Obviously, if the internet is any judge of things, it is still a conversation starter today and still gets a lot of people's attention.
Yeah, for sure. It's interesting. I was talking about how in some ways I think it's religious or like group suicidal ideology, because it's like you've been promised this cult perfection, right? And then you realize like, no, the world is flawed and problematic and complicated. And it's like, oh, let's just check out. Instead of like, no, we actually have to look at this stuff and fix these systems and pull these apart. So, it's a little bit in everything. And this has been such an illuminating conversation. Thank you so much, Joe. And thanks everybody for tuning in today.
Absolutely. Thanks, Joe. And we'll see you soon. Daniella, thanks always. And thank you to our audience. Make sure you hit that like and subscribe button and share this with a friend that could benefit from the conversation. For Daniella Mestyanek Young, Knitting Cult Lady, I'm Scot Loyd. We'll see you on the next episode of Cults and the Culting of America.